Arnold Schwarzenegger is here today for his wellness examination. Today he presents with a chief complaint of back pain. He states that the back pain started about 1 week ago after working out. The pain is located on his lower back, and he states that the pain is intermittent in duration, it comes and goes. He describes the pain as an ache, and he does have spasms that are associated with it. The pain is aggravated with movement and with bending. The pain is relieved with rest. There is no specific time frame of the day in which the pain is worse, and he rates the pain currently 2 out of 10 on a numeric pain scale. He states he does have history of chronic lower back pain from years of working out, and he also does state that he has had these symptoms before from a previous workout session injury. He is not currently taking any medications for this pain. He states that he is able to handle it, and his motto is no pain, no gain. A little background information about Arnold is that he is a 73-year-old male Austrian-American actor well known for his role as the Terminator. Arnold's vital signs are blood pressure is 158/95, which is elevated. He states that he checks his blood pressure daily and that it has been running high every day for the past 6 months, and he is currently not taking any medicines for it. His heart rate is 70 beats per minute. His respiration rate is 19 breaths per minute. His temperature is 98.6 degrees Fahrenheit. That was taken orally. His oxygen saturation rate is 99%. That's on room air. His pain is 2 out of 10 on a numeric pain scale on his lower back. His height is 6 feet 2 inches. His weight is 235 pounds, and that brings his BMI out to 31. Arnold has past medical history of chronic renal failure, which is related to his long-term anabolic steroid usage for bodybuilding. That was first diagnosed in 2008. It is active and current. He has also had right-sided rotator cuff tear due to a fight that he had with Rocky Balboa. That was in 2000, and it is not current and inactive. And then he also has history of chronic lower back pain due to years of strenuous exercise bodybuilding, first diagnosed in 1998, and it is still current and active. Arnold's past surgical history includes right rotator cuff arthroplasty in 2000 after his fight with his good friend Rocky. He has also had lumbar spinal fusion L5 to S1, that was back in 2010. Arnold's medications and supplements, he does use anabolic steroids. He uses 500 milligrams intramuscular injections weekly for his muscles. He takes a daily multivitamin, 1 tab orally daily just for wellness. And then he also does use protein powder supplement 50 grams orally daily. He denies any use of any other medications, supplements, or herbals. Arnold has no known drug allergies, but he does state he is allergic to shellfish seafood. This includes lobsters, crabs, oysters, and the reactions that he usually gets when he eats seafood or is around seafood is hives and rashes. Arnold's social history: he denies any tobacco, alcohol, or any recreational drug use. He does admit to using anabolic steroids for bodybuilding competitions and tournaments that he does participate in pretty much throughout his entire life. He is married. He is a heterosexual, and he does state he does use safe sex practices. His occupation includes he's an actor, a filmmaker, a businessman, and also he is a former governor for the state of California. Arnold's family history includes his mother was a diabetic type 2. She died at the age of 85 years old. His father was an alcoholic, had a stroke, and passed away at 86 years of age. And then his brother is alive, does have history of high cholesterol and high blood pressure, hypertension. Arnold is up to date on all his immunizations, vaccinations. His last Tdap that he had was January 2018, so he is good for another 10 years, so he'll be good till 2028. He also got his last flu shot this past October of 2019. Arnold had both his prostate exam and his colorectal screening at 50 years of age. He also states that he does perform monthly self-testicular exams to check for lumps, masses, and any lesions. So upon physical examination, Arnold appears to be alert, well-appearing. He does have good hygiene. He maintains consistent eye contact throughout the entire physical exam. He appears comfortable with no signs of acute distress. His head is normal cephalic. His hair is brown with fine textures. It's evenly distributed. Sinuses are non-tender with palpation. Nares are pink and patent. Pharynx is also pink with 2+ tonsils, and there is no drainage present inside his throat. His ears are symmetrical, non-tender, no drainage appearance. Otoscopic examination reviews great tympanic membrane with no signs of drainage or infection. His eyes are symmetrical with no redness, jaundice, or any drainage present. Visual acuity is 20 out of 20 on a Snellen chart. And fundoscopic examination reviews a creamy yellow optic disc with distinct margins, and there are no signs of hemorrhage or pallor. All lymph nodes are non-palpable, non-tender, and non-swollen from head to toe. Cardiovascular heart sounds are regular in rate and rhythm. S1 and S2 are heard on auscultation. No murmurs, clicks, or gallops are present. There is no peripheral edema in all extremities, and also all extremities pulses are +2 bilaterally. Respiratory examination, posterior-anterior diameter is 2:1 ratio. Lung sounds are clear anterior-posteriorly. There are no wheezes, rubs, rhonchi, rales, accessory muscle usage, labored breathing, or any respiratory distress present. There is also no CVA tenderness noted on the posterior thorax, and chest expansion is symmetrical. One of the quotes that Arnold says is, "You breathe in courage and you exhale fear." Gastrointestinal examination, abdomen is flat, soft, symmetrical. There are no masses, lesions, or pulsations present. Bowel sounds are normal active in all 4 quadrants. All 4 quadrants percuss tympani, and the liver spans 6 to 10 centimeters. Spleen is non-palpable. Musculoskeletal, all extremities have full range of motion. There are no crepitus, clicks, or pops heard on all major joints. All major joints are non-tender upon palpation. Shoulders are symmetrical. Spine is symmetrical with limited range of motion due to the pain from his recent workout back injury. Lower back is tender upon palpation with movements, and upper back is non-tender. Patient is still able to have a smooth, steady gait. Neurology assessment, he is alert-oriented ×4. He has full sharp/dull sensory in all extremities. All deep tendon reflexes is +2, and cranial nerves 1 through 12 are all intact. psychiatric examination, there are no signs of restlessness or anxiety present during the exam. Arnold does state he is a little slightly depressed because he is not able to work out due to his back injury. So the principal diagnosis that I came up with for Arnold is lower back muscle strain due to recent workout injury. Lower back muscle strains occur more commonly in patients that are 20 to 40 years old, and the typical clinical manifestations are lower back pain that is described as an achy spasm which is worsened with activity/bending. The first differential diagnosis for Arnold is spondylosis, and it can occur at any age, and it can be due to excessive mechanical load along with wear and tear of the lower spine. The classic presenting symptoms for lumbar spondylosis consist of back pain that radiates down to both buttocks to the lower extremities. The second differential diagnosis is lumbar disc herniation. It can be caused by multiple factors, including aging, injury, or heavy lifting. The common symptoms for lumbar disc herniation are sharp, burning pain that radiates down to the area that is enclosed by the nerve root associated with numbness, tingling, and weakness. The pharmacological treatment plan that I have for Arnold, I am going to recommend ibuprofen 400 milligrams orally every 4 to 6 hours as needed for mild to moderate pain, with a maximum dose of 3,200 milligrams per day. The standard cost for ibuprofen for 400 milligram tablets is $4.63 at CVS Pharmacy, so it is pretty affordable. He is going to be advised to take the medication with food to prevent upset stomach. And the most common side effects that would be advised is headache, nausea, and, like I said earlier, dyspepsia, upset stomach. The second medication that I like to prescribe for Arnold is cyclobenzaprine. That's a muscle relaxer. He's going to take 10 milligrams orally every 8 hours as needed for muscle spasms, with a maximum dose of 60 milligrams per day. The cost for cyclobenzaprine is for 30 10 milligram tablets, it's $6.64 at Costco Pharmacy, which is also pretty affordable. It is recommended to perform good oral hygiene, use frequent mouth rinses, and to chew on sugarless gum to minimize the common side effect of dry mouth. The most common side effect includes for cyclobenzaprine is dry mouth, dizziness, and drowsiness. The next medication I like to prescribe would be lisinopril. That's 10 milligrams orally daily for hypertension. When Arnold presented, his blood pressure was elevated, so I like to start him on this medication to try to control his blood pressure. There is a max dose of 80 milligrams per day, so the dosage can always be titrated up if the blood pressure does not decrease with this initial starting dose. The cost for lisinopril, there would be 30 tablets of the 10 milligram tablets, and that is $4 at Walmart Pharmacy. So this one is also very affordable. It will be educated to Arnold to monitor his blood pressure and pulse during the initial dose that we start him on, and after that, once it starts to get regulated and more controlled, we can do more periodic monitoring during therapy. The most common side effects that would be educated to Arnold is a barking cough, dizziness, and hypotension that can be associated with this medication usage. The non-pharmacological treatment plan for Arnold, the first recommendation would be to rest. We want to prevent further injury to the muscle and to promote and allow healing to occur. We would also recommend for Arnold to use ice. Ice actually decreases blood flow to the area. This helps in reducing swelling, muscle spasm, and also does alleviate pain. And then the third recommendation is once Arnold's muscle starts to heal, he can start doing light stretches, and this is following the rest period. And then the stretching helps increase blood flow back to the injured site to promote restoration. The Anticipatory guidance for Arnold, I would first recommend for him to do another colorectal cancer screening because it's been a while since he did his last one. It is recommended for adults aged 50 to 75 years old to get a colorectal cancer screening, and it's usually to be rechecked every, I believe, 10 years. High blood pressure screening and home monitoring, since his blood pressure is elevated and we are starting him on the new blood pressure medication, it is recommended for us to continue to screen and do monitoring. The third recommendation is to educate Arnold and counsel him about the harmful effects of anabolic steroids. I know he's been using it for a long time, and he does use bodybuilding and exercises a lot, but he does have the chronic renal failure, so we would be educating him about the increase in risk that he has with using these type of agents. The fourth recommendation is statin use for the primary prevention of cardiovascular disease. This is preventative medicine that can be used for adults 40 to 75 years of age. He is 73 years old. He presents with elevated blood pressure, and he does have cardiac history in his family history. So I would like to start him on some statin usage for prevention. And then the fifth recommendation I have for Arnold is about sexually transmitted infection behavior counseling for sexually active adults. So since he is married and he is sexually active, even though he's 73, it is also still recommended to continue to counsel and educate Arnold about the side effects and risks of unprotected sexual transmitted disease.
Arnold will follow up in 2 to 3 weeks for a reevaluation of his back function and symptoms to determine if there's any further intervention or whether an orthopedic consult is necessary. He will be advised to notify his healthcare provider if lower back has changes in color, temperature, sensation, such as numbness and tingling, range of motion, and if there's an increase in pain that is not relieved by pain medication.
Alright, I think Arnold has one last word that he'd like to say to everybody. I'd like to thank you for your time.
Hasta la vista.
Alright, thank you guys.